some of the muscles are kind of difficult to see on our cat just because of the size. So some of these are just estimates. But up here, the black pin would be the clavotrapezius. It's the back of the neck. And then behind it right here would be the levator scapulae ventralis. Behind that would be the acromiotrapezius. Beside that would be the spinodeltoid muscle. And then back here would be the spinotrapezius muscle. Up here would be the acromiodeltoid. Up here would be the clavobrachialis. And then over here would be the latissimus dorsi. So for the back of the arm, up here, this blue represents the triceps brachii lateral head. The green in the middle, it's representing what's up underneath, which is the triceps brachii medial head. And then the lower portion on the bottom is called the triceps brachii long head. So for the arm muscles, starting up here with the blue pin, which is the brachoradialis, which I believe it is right here, it has been torn. And then next, the pink pin is the extensor carpi radialis brevis. And it should be like right next to the brachoradialis, but I believe that it has also been torn away. And then next is the yellow, which is the extensor digitorum communis. And then this white pin would be the extensor digitorum lateralis. Then up here, the red pin is the extensor carpi ulnaris. And then this green pin over here is the brachialis. And then this blue pin is the aconius, which is near the elbow.
This pink pin is the lumbodorsia fascia. Then over here, we have the rhomboideus thoracix, the rhomboideus cervixus, and the rhomboideus capitis. Here we have the supraspinatus, the teres major, and the infraspinatus. The black pin underneath the scapula is the subscapularis. This flap in between here is the splenius. Here we have the epitrochlearis. Here underneath, we have the bicep brachii. Here's the pronator teres. Here, I'll do this one first, is the flexor carpi radialis. Here's the flexor carpi ulnaris. And this is the flexor digitorum superficialis. So here we have the external oblique and the internal oblique. They're hard to separate, but they're right there. And underneath is the transverse abdominis. So here in the black pin, we have the serratus ventralis. The pink pin is the scalenes. The top green pin is the transverse hysterum. And down here is the rectus abdominis.
So up here, above the serratus ventralis is the serratus dorsalis. And then over here, this red pin shows the intercostalis internus. And there's this little flap that shows the outside versus the inside. The white pin represents spinalis dorsi. It follows the spine all the way down. And then beside it is longissimus dorsi, which follows closely beside the spine. This thin muscle located on the backside of the cat and along the end of the spinal cord back here is, it's called the multifidus spinae.
Good.
So first with the red, with the yellow, we have the pectineus, and then next is the abductor longus, and then next is the abductor femoris, and then next is the semimembranous. The next is the semitendinosus. On the backside of the cat, up here would be the gluteus medius, and then following that would be the gluteus maximus. down here would be the tensor fasciae lata, which isn't really seen right here, but it's just a thin layer of tissue. And then back here, the red would be the biceps femoris. On this side of the leg, there would be a muscle covering, and on the outside it would be called the sartorius. And then on this side, which is the inner side, it would be called the gracilis. So the yellow represents the sartorius and the blue represents the gracilis. The red on top right here is the rectus femoris. The black on the side is the vastus lateralis, and the red on the inside right here is the vastus medialis. And then this pink represents the vastus intermedius, which is it's underneath the rectus femoris. So these three are pretty hard to see on our cat, but I can kind of give you the general location of where they would be. So the psoas major, it's a groin muscle, and it would be in here, and it is in between the psoas minor, which is on the inside, and the iliacus, which is on the outside. So the iliacus would be lateral to the psoas major, and the psoas minor would be medial to the psoas major. For the leg muscles, right here, this would represent the tibialis cranialis, and then next the yellow would be the extensor digitorum longus, and then this blue would be the peroneus longus. And these are kind of like estimated locations just because it was a little hard to tell on our cat. And then the muscle that is right here is the plantarius. And then back here, these muscles that extend off, on the bottom right here, we have the gastrocnemius, and then right here beneath it is the soleus.